Thanks for tuning in. Dr. Marshall here with Medical Specialty Clinic. Got something really neat to show you today. We've got a new product in at the office. We're very excited about it. It is called Upneeq. And if you don't know what that is, it is an eye drop that you put one drop in your eye and it lifts your eyelid just a little bit to make your eyes sparkle, look a little better, a little more prominent. It's pretty simple on how it works. It is basically a stimulant, a sympathomimetic, so it activates the sympathetic nervous system, which is the fight or flight response. The sympathetic nervous system, when it gets activated, depending on which part of the body is activated, it does different things. So in the eye, it opens your eyes, and on the pupil, it would dilate it, but I don't think this actually dilates your pupil. It just lifts the eyelid. But when our sympathetic nervous system gets activated over the whole body, our pupils dilate so we can see better, our eyes open wide, our heart rate increases to pump more blood, our digestion shuts down, and our muscles can work a little more efficiently, things like that. So it activates that, and the active ingredient is oxymetazoline. That is the same ingredient that is in Afrin. Now, Afrin nasal spray for sinus congestion, it's a decongestant. So sympathetic nervous system would dry up the secretions in the nose and help you out with that. Now, that's a different formulation. That's nasal spray. Don't put that in your eye, and I wouldn't recommend putting Upneeq in your nose either. So it's a different concentration also. But anyway, it's pretty neat. It comes in a box. We carry it. We offer it two different ways. So this box has 45 vials in it. So I'll open it up here. And in one box, there are 45 packages. Now, this box is for 45 of these packages is $200. You can get 15 for $75. What is in there is a little plastic vial that you take out and you kind of twist the top off, and it has a little liquid in it, enough for one drop in each eye. So you take that, and after just a few minutes, you'll notice that that eyelid will be a little higher. And I'll show some before and after pictures of some people that have used it at the clinic and really liked it. It's individually wrapped for each dose. Takes a few minutes to work, but you should notice full results in 2 hours, and it lasts 8 to 12 hours depending on the person. So it pretty much lasts for, during the day if you wanted to use it, or if you were going to go out that evening and you wanted your eyes to pop, really get a good look. And since it's a sympathomimetic, it actually constricts the blood vessels in the white of the eye a little bit, so it'll take out a little of the redness from the blood vessels, and the white of the eyes will look a little brighter as well. So it really makes your eyes stand out. And if you're a fan of history, you'll know that women have been using things to make their eyes and face look more beautiful for thousands of years. The belladonna plant, which belladonna means beautiful woman, that you put that in the eye and it will dilate the pupil, so you'll have this huge pupil. The woman, if they do that, they can't see real well after that, but which may be by design. They may not want to see the man they're with, but they will look very beautiful for a little while till that wears off. Not to mention eyeliner and things to make your eyelashes thicker, longer, and then eyeshadow and things like that. So women have been trying to augment their eyes for millennia. So anyway, this is something you might want to look into. And like I said before, it's enough for one drop in each eye, and then you're supposed to throw it away. But I have been told, I'm not advocating for this, but I have been told that there is actually enough in here for 2 drops in each eye. So if you saved it, you could potentially use it twice instead of just once. Again, the prescribing information is to use it 1 drop in each eye and then discard the remainder. And you're not supposed to touch it to the eye or anything like that, so you need to get a good routine for using it. You can use it with contacts, not while they're in. You have to take your contacts out, put the eye drops in, and then after 15 minutes, I probably would wait a little longer than that, but after 15 minutes or so, you can put your contacts back in. It shouldn't hurt anything. What it does is it just causes that muscle that lifts the eyelid, the upper eyelid, to contract just slightly, and it's very simple. Shouldn't cause too much trouble. The only problem you would want to watch out for is if you have glaucoma, especially closed angle glaucoma. You would not want to use it because it could worsen that and then really increase the intraocular pressure. But otherwise, it doesn't cause any trouble, and it doesn't raise your blood pressure or anything like that. It's not going to go systemically through the whole body and cause any trouble. So really pretty neat little thing, and safe. I would recommend it if you're looking for something to help with your eyes. And really the main benefit, what this would be for other than just cosmetics, would be for treatment of a ptosis. That's a ptosis with a P, P-T-O-S-I-S. So patients who've had a stroke or have genetic problems with an eyelid, one or both eyelids, that eyelid will droop. I have one patient in particular that had a stroke, and all it affected was the eyelid. Their left eyelid is just slightly lower, and when they look around, they can kind of see that in their visual field, and it irritates them. And they'll use these drops. It lifts it just a little bit, and they can see the normal visual field. So that's really the medical side versus the cosmetic side. So I did want to mention that as well. So if it's something where you have a eyelid that's down, there's lots of different neurologic conditions that can do that. You could have been hit in the eye or the face, and that caused some trouble. Stroke, Bell's palsy can cause eyelid to do weird things as well. So just wanted you to be aware of that. If you're interested, give us a call at the office. Be glad to help you out and get you set up. Thanks for tuning in. I hope you enjoyed the video. Don't forget to like and subscribe. I did not demo this. I'm not going to demo this because I don't know that the ladies could handle it if my eyes were any more attractive on the channel here. So I'm kidding, of course, but anyway, just we'll show some before and after pictures, but I'm not going to do any demonstrations here on camera for you. Anyway, thanks again, and look forward to seeing you in the next video.